Welcome to Anatomical Yoga. We'll start at the top of our mats in anatomic position, gently elevate and retract your scapula with ever so slight cervical circumduction. Now, flex your dominant hip and knee while an externally rotated contralateral hip and flex knee allow you to rest your foot on your thigh. Next, we'll move on to my favorite, the downward Vesalius. If none of that made sense, then keep watching this video because today we're talking about movement terms. What's up, y'all? My name is Pat Kelly. I got another anatomy lesson for you. Today, we're talking movement terms. These are all the motions as they apply to the body. So we're gonna go over what those movements are, what joints they apply to, and give you a few memory devices so hopefully you can remember them easier. I made this video to accompany my anatomical regions and directional terms videos. So if you haven't seen those, I'd recommend clicking that link right there to get a little bit of background. So here's the big picture. We have multiple joints that all move in incredibly unique ways, so simple terms like up, down, and sideways don't apply here. We need unique terms to describe unique motions. And when we're talking about anatomical motion, we reference an imaginary body in something called the anatomic position. That's standing upright with feet forward, arms by your side with palms forward, and head neutral looking forward. I've said it before and I'll say it again. Always refer to the anatomic position whenever you're talking about direction or motion. This is forever and always your starting point in anatomy. Why? Well, it's tempting to say something like move the patient's leg up to refer to hip flexion when someone is in the anatomic position, but that's a completely different motion than if they're lying on their side. So in order to standardize language, we always refer to the anatomic position. The second thing to keep in mind is that there are different planes of motion and different axes of motion with which these limbs and joints move around. Obviously, your body exists and moves in 3 dimensions. So while some motions seem like they happen in a very straightforward, linear way, most day-to-day motions are a combination of those. Let's start with abduction, which is movement of a joint away from the midline of the body, and adduction, movement towards the midline of the body. Specifically, this midline on the sagittal plane. Now, clearly these words sound very similar, and some folks will painstakingly spell it out abduction to make it super clear. But the difference is actually way easier to remember. I picture an alien abduction taking my arm away from me, whereas with adduction, I'm adding to the size of my body. You'll see these motions all the time with shoulders and hips, but you can also apply them to fingers and wrists. In those cases, abduction doesn't necessarily mean going away from the body's midline, but from the midline of the hand. So really, finger abduction is the same thing as spreading your fingers, while adduction is closing them. One little note though, some clinicians will call this motion wrist abduction or adduction, but some will say radial deviation, meaning the hand is moving towards the radius, or ulnar deviation towards the ulna. They're the exact same thing, but since the hand and wrist are so often not in anatomic position, they're easier to remember this way. Next up is bending and straightening. More technically, flexion, which is a decrease in the angle between 2 joints, and extension, an increase in that angle. It's pretty intuitive for joints like the knee, elbow, or even spine, but some joints are a little trickier. Like this is shoulder flexion, and to me, it just looks like my arm is going away from my body. So I had to come up with a separate way to remember flexion versus extension. I remember that flexion is like the fetal position, which clearly both start with F. Check it out. The hips and knees are in flexion, the shoulders, elbows, and wrist are in flexion, and the neck and all parts of the spine are in flexion. That's right, flexion and fetal, the 2 best F words for any memory device. Extension is the opposite. You're increasing the angle between 2 joints, which usually results in straightening the limb or extending it past that frontal plane midline. But be careful because flexion and flexing are 2 very different things. When we say flex a muscle, what we're actually saying is to put tension on it, to contract it. And yeah, when you're flexing your bicep, you're also doing elbow flexion, but you can flex your quadriceps while you're extending your knee. Got it? Rad, moving on. Next up is medial and lateral rotation, sometimes called internal and external rotation. And just like picturing rotation from physics, we first need to figure out what our axis is. So for both the shoulder and the hip joints, our axis is gonna be an imaginary line running through the long bone of those joints. You can do this with me. If you stand up and lock out your elbow and rotate your shoulder so that your thumb starts pointing towards your midline, you've medially or internally rotated the shoulder. Now, on the flip side, the thumb is heading back out, so we're doing lateral or external rotation. Same thing with the hip joint. If you stand up and lock out your knee, when the foot goes towards the midline, that's medial rotation. If it goes out, lateral rotation. But remember, movement terms use the anatomic position as a reference. So if we're in standing, we can get away with using our hands and feet as little guides, but that might completely disappear if we have our person change position. Like, imagine for whatever reason you wanted to assess a patient's internal shoulder rotation in a seated position. It's going to be really difficult to work with a straight arm, so you have your patient bend their elbow. Now, in this case, internal and external rotation still make intuitive sense. My arm is going towards the midline or away from the midline, which agrees with the long axis rotation we defined earlier. That's awesome. Unfortunately, that doesn't translate to the hip joint. Right here, I'm actually doing medial hip rotation. The long axis of the femur is rotating towards the midline, but my lower leg is all out to the side. Vice versa when I do lateral rotation or when you test this in the supine position. Okay,